Hi friends, in this session I'll be discussing about the gastrointestinal tract. In this I'll be discussing about the first thing is I'll be discussing about anatomy of esophagus. We will be going in detail regarding the esophagus. Okay, the first thing written here is in the anatomy. It commences at the base of the pharynx at C6 and terminates in the abdomen, where it joins the cardia of the stomach at T11. And it also written that at the level of the carina, it deviates to the right, okay, to accommodate the arch of aorta. Then it winds its way back up the left main bronchus and it enters the diaphragm at T11. So what is it trying to tell us is, so if you look into the structure, like if you look into the diagram, so this is a diagram which shows the position or the location of the esophagus. So the brown one which you are looking into, this is an esophagus, okay. So where it is starting? It is starting at the level of C6. So you can look into this. It commences at the base of the pharynx. So you can see this is the pharynx. So this is which muscle? Inferior, okay, inferior constrictor muscles of pharynx, okay. So it starts from the C6. Remember, starts from C6, and it terminates in the abdomen. This is abdomen. At what level? When it terminates? After it joins the cardia of the stomach. So this is the cardia of stomach. So after joining the cardia of the stomach, it terminates, and this cardia is at T11. So this is T11. Okay, two main points you should understand. Now the second point written here is, it's written that at level of the carina, it deviates to the right and accommodates the arch of aorta. So what is it trying to tell us? So if you look into this, this is a esophagus, right? This is a trachea, right? This is the bifurcation of the trachea. This is an aorta. Now, now the esophagus, right? Esophagus, when it moves down, moves down. Remember that the esophagus, it is present on the left side, right? It is an organ of left side. From the left side, from the left side. Now what does it do from the left side? This esophagus, it deviates to the right side. Remember that deviates to the right side to accommodate the arch of aorta. That means just remember that the esophagus is an organ of the left side. So at the carina, the point of for bifurcation of the trachea into bronchus, left bronchus or right bronchus, it deviates from the left, it deviates to the right, and it accommodates, right? Accommodates the arch of aorta. Right. Now, after it deviates to the right from left, what does it do? It winds around the left bronchus. Remember that left bronchus. So remember that the esophagus is the organ of the left side, right? And it is deviating to trying to go to the right. During the movement from left to right, what does it do? It hooks around. Remember that it winds around the left bronchus. Then it comes to the right. So that's what it's trying to trying to tell us. Now this enters the diaphragm at T11. So you can look into this T11, the esophagus enter the diaphragm. Okay, enter the diaphragm. So you have an important question here. Now you have got something known as pharyngeal constrictor muscles. There are three pharyngeal constrictor muscles. What are the three pharyngeal constrictor muscles? One is superficial, middle, and inferior pharyngeal constrictor muscles. Now, the inferior constrictor is the final bridge between the pharynx, okay, pharynx and esophageal musculature. And it's also written that inferior constrictor is made up of two muscles. One is thyropharyngeus and next is cricopharyngeus. The potential weakness between the two muscles is known as Killian's stasis. So what is it trying to tell us is, now if you look into the right, if you look in this is the posterior aspect of the this is the esophagus and this pharynx. Remember that you have a muscle here, and this muscle is known as, what is the muscle? Thyropharyngeus. Okay, thyropharyngeal muscle. And this is a cricoid. You have a cricoid bone. Okay, you have a cricoid bone that we'll be discussing, and this is a cricopharyngeus muscle. Now this thyropharyngeus muscle, okay, and the cricopharyngeus muscle, these two are the part of inferior constrictors. Now this transversely placed, or you can call this is as, what do you call, this is an obliquely, sorry, this is an obliquely placed thyropharyngeus muscle, and the horizontally placed the cricopharyngeus muscle. In between you have a space in the sense there will be a triangular space, and that is known as the, what do you call, you have in some conditions you have a space in some conditions where there is a weakness between the two muscles, thyropharyngeus and cricopharyngeus. So there can be an hernia, contents can come out. So it is known as the dehiscence. This dehiscence is known as a Killian's dehiscence. That means the potential weakness between the thyropharyngeus and the cricopharyngeus is known as Killian's dehiscence, and the diverticulum which it comes is Zenker's diverticulum. Okay, it is known as Zenker's diverticulum. So that's all you need to understand. The next thing is we need to discuss about the esophageal inlet. And what is it trying to tell us is the cricopharyngeus muscle is responsible for generating an high pressure zone that makes the position of the upper esophageal sphincter and esophageal introit. And it's also written that its distinctive bowing array of muscle fibers is unique and serve to transition to the circular esophageal musculature. And it's also written that this point of transition is flanked by the longitudinal esophagus muscle that superiorly attached to the mid portion of the posterior surface of the cricoid cartilage and forms the V-shaped area of laminar triangle. So what is it trying to tell us is, so if you look into it, the cricopharyngeus muscle is responsible for generating a high pressure zone that makes the position of the position that upper esophageal sphincter and esophageal introit. So what is it trying to tell us is, so if you observe carefully here, right, observe carefully, you have a cricopharyngeus muscle. Okay, this is a cricopharyngeus muscle. This cricopharyngeus muscle is responsible for generating a high pressure. It is responsible for generating high pressure zone that makes the position of the upper esophageal sphincter and esophagus. That means if you look into this, this is a cricopharyngeus muscle. Okay, and this cricopharyngeus muscle, it is responsible for the high pressure. And why it is responsible? And if you look into the structure of a cricopharyngeus, and it is like a bow. So if you observe this is a bowing, right? So the muscle which starting at this point, it bows to the opposite aspect. That means this is a bowing. Okay, this is a bowing, right? So this distinctive bowing array of muscle fibers is unique. Why it is unique? And serve to transition into the circular esophageal musculature. That means this cricopharyngeal muscle, which is a part of inferior constrictor, it continues as circular muscles. Remember that it continues as circular muscle. And the same thing, this cricopharyngeus is responsible for the high pressure zone, right? And high pressure zone, and that makes the position of upper esophageal sphincter. And this itself is a response. That means that it is an esophageal entry point. And this cricopharyngeus continues as an circular esophageal musculature. Okay. Now, the point of transition is flanked by the longitudinal esophageal muscles that move superficially and attached to the mid portion of posterior surface of cricoid. Now, if you observe carefully here, these are the longitudinal fibers. Remember, these are the longitudinal fibers. And these longitudinal fibers, if you observe carefully, they are attached to the posterior. This is a cricoid. Okay, this is a cricoid. They are attached to the posterior aspect of cricoid. Okay, cricoid cartilage. Now this is absorbed, right? This is attached to the posterior portion of cricoid cartilage. Now either side, this side and this side, they move and they converge, and you can look into this. You can see this. This is an circular layer. And the left longitudinal fibers and the right longitudinal fibers, which are attached posterior aspect of the cricoid cartilage, then form a triangle. The triangle is formed by the longitudinal muscles and this cricopharyngeus muscle. Okay, and this is known as Lymer triangle. That is Lymer's triangle. Okay, they form a V shape. That's what it's trying to tell us. The point of transition is flanked by, and this what is it? It is a transition of what? Of a cricopharyngeus to the circular muscles. Now, the part of transition is flanked by the longitudinal esophageal muscle. That external super, that notice that that external superficial, that means they attach to the mid portion of the posterior surface of the cricoid cartilage and form V-shaped area of Lamere triangle. Okay, that's what we need to understand, right? So this is, if you look into this, the points here, if you need a constrictor muscle, cricopharynge, you have a circular muscles, okay, that is circular muscles, longitudinal, you have an that is an the same, okay, that's what you need to understand. Now, muscles in the esophagus. The inner circular muscles is the extension of cricopharyngeus muscle and traverse through the thoracic cavity into the abdomen, where they become the middle circular muscles in the lesser curvature of stomach. Now, what is it trying to tell us? Okay, just remember that. Now, what is it trying to release? Middle circular muscles. Now, if you look into this diagram, okay, if you look into this diagram, it's written that the inner circular muscles, which I have already discussed, the inner circular muscle continues of this cricopharyngeus. Now, when it comes down, the inner circular muscles is the extension of cricopharyngeus muscle, traverse through the thoracic cavity into the abdomen. They've gone into the abdomen, and remember where they become the middle circular muscles on the lesser curvature of stomach. See, this is a greater curvature. This is what lesser curvature. And if you observe these circular muscles, they become the middle circular muscles. So these are the circular muscles. These are circular muscles. Okay, these are the circular muscles. Okay, these are circular muscles. So these circular muscles, what they do is they loop, they at the lesser curvature, they continue as an middle circular muscles. Okay, middle circular muscles. Now, what happens to the next important aspect? The next important is the collar of the what is it? The collar of the helvatus. Okay, the collar of the helvatus marks the transition of circular muscles of the esophagus to oblique muscles of stomach at incisura, that is the cardiac notch. The outer longitudinal muscles continue as longitudinal muscles of stomach. Now, what is it trying to tell us? Now, if you look into the points here, the circular muscles continues in the lesser curvature. They becomes the middle circular muscles. They become the middle circular muscles. What happens in the greater curvature? In the greater curvature, these circular muscles at the point of incisura, right? Incisura, or you call this is a cardiac notch. Okay, this is a cardiac notch. Now, what happens here is the circular esophageal muscles, at this point of collar of helvatus. Now, there is a transition of circular muscles to these are the oblique muscles. Okay, circular muscles and the oblique muscles at incisura or cardiac notch. Now, this is the second basic point you need to understand. And the next point is the outer longitudinal layer. If you observe the outer longitudinal muscles continues as the longitudinal muscles of stomach. So that's all you need to understand. We spoke about the circular muscles, we spoke about the longitudinal muscles. Now, let us understand. Now, you have got something known as striated and smooth muscle, right? Now, it's written that distal to this tracheal bifurcation, there are no striated muscle. The upper esophagus is made of striated muscles. The first smooth muscle appears 2 to 3 mm, okay, to caudal through the upper esophageal sphincter. There is gradual change of the striated muscle to smooth. So if you look into this point here, right, the first point written here, distal to the, this is a tracheal bifurcation. Distal to the tracheal bifurcation, there is no striated muscle. There is no striated muscle. So the striated muscle is present after, that means after the bifurcation of the trachea. Right, distal to the trachea bifurcation. Remember, there is a smooth muscle. You don't have any striated muscle here. The upper esophagus is made up of striated muscle. The upper esophagus, where above the tracheal bifurcation is striated, below the tracheal bifurcation is smooth. But the point you need to understand, 2 to mm caudal or 2 to mm caudal to the upper esophageal sphincter. What is upper esophageal found for cricopharyngeus? Just 2 to 3 mm, right? 2 to 3 mm. If you observe 2 to 3 mm, this is a cranial. 2 to 3 mm, you have a smooth muscles here. Other salt here is striated. After the bifurcation of the trachea, you have a smooth muscles. Now there is a gradual change of striated muscle to smooth muscle, straight muscle to smooth muscle. So this is an important question you need to understand. Now let us finish this session by speaking about we have got something what a natural constrictors. So it's written that hourglass shaped, okay, and esophagus. You have a constriction at the of esophagus at 14 mm from the incisors. That cricopharyngeus, and you have a one more constriction. You have an bronchio aortic constrictions at the level of T4, that is 15 to 17 mm, and you have diaphragmatic constriction 16 to 19 mm, dilated parts of esophagus 2.5 centimeters. Now, what is it trying to tell? This is, if you look into the diagram here. Now, say, for example, I have drawn directions. I have in centimeters. Okay, from the incisors, if I move into this, okay, down. Now, what happens? You have 3 constrictions which we need to understand. 3 constrictions. What are the 3 constrictions here? The constriction, the first constriction, which is of 14 mm, right? Which is of 14 mm. Where exactly it tells 14 mm? You have a cricopharyngeus, which I have already discussed, right? We have already discussed here. Cricopharyngeus muscle, there's one constriction, there is a 14 mm, and you have got a broncho-aortic constriction, okay, at the level of T4. This is the aorta, right? The constriction happens to the esophagus at the level of aorta. It is T4, right? T1, T2, T4. How much it is? 15 to 17 mm. Next, diaphragmatic constriction, which is 16 to 19 mm. Okay, 16 to 19. So above downwards it is increasing. 14, yeah, 15, then 16, right? Now, if you look into the points here, the dilated, right? There are 2 points it dilate. Okay, the dilation of the esophagus happens at 2 points, and the maximum dilation is 2.5 centimeters. Okay, 2.5 centimeters, 2.5 centimeters. So that's all. And the point you need to understand, where exactly, if you look into the distance of the constriction, right? If you look into the distance of the constriction, if I start from the incisors, from the teeth, if I go down, okay, this cricopharyngeus, it is 15 centimeters from the incisors. Okay, from the incisor it is 15 centimeters. Okay, next point you need to understand, from the incisors to the aorta, it is what? It is, you need to add 10, that is 25 centimeters, right? In Sebastian, it's written that 23 centimeters from the incisors, and the constriction at the level, 2 constrictions, right? This one is aortic constriction, and next is bronchus constriction. Bronchus constriction 2 centimeters more below, so 25 centimeters. And at the diaphragmatic constriction, the diaphragmatic constrictions at 40 centimeters. So just easy to remember, right? 15, 25 and 40. So that's all you need to understand in this session. Let's meet in the next session. Thank you.